Hi, my name is Jason Brophy, and I'm a pediatrician and infectious disease specialist in Ottawa. In my practice, I see a lot of children and their families who come to Canada as refugees, and I can testify that in the past, the IFHP, or Interim Federal Health Program, has been life-saving. The proposed changes to the program, however, are significant and will definitely lead to poorer health outcomes for these kids and their families, of whom at least a half will become Canadian citizens eventually. We know that preventive and prompt health care saves lives and costs. With the proposed changes, prenatal care won't be covered for pregnant women from designated countries of origin or whose initial claims have been refused, and coverage of preventive health care for children and infants from any type of refugee situation will not be covered. And so my question for Minister Kenney is, why is the CIC leaving these vulnerable children without health care?
Hi, my name is Mohammed Azeem Rafiq. I'm from Toronto, Ontario. I recently got married to my wife back home in Pakistan, and it states on the immigration website that it takes about 26 months for her application to be processed and for my wife to come to Canada and join me here. And whereas for some other countries it takes about 6 months for the spousal sponsorship. So it gets frustrating, and to be waiting for your loved ones for about 2 to 3 years, and for them to come over to Canada. So my question to Mr. Kenney is that what is Ottawa doing to make this better for the citizens and shorten the time of the spousal sponsorship? Thank you.
Hi, my name is Kim Boyd, and I'm from Victoria, British Columbia. And I am a Canadian, like many in my community, who are interested in being a part of a global community as well as a national community. And there are many families here in Victoria who, together with myself, are sponsoring a young man's education in the Ivory Coast. We have tried for a few years to bring this young man to Canada to study, and have learned that the cost is very, very expensive. It's probably 3 or 4 or maybe 5 times more expensive than it is for a Canadian to study here. So I've been to Africa to help this young man look for an adequate school, and I couldn't help but notice the education system does not match the high-quality Canadian education that we have here at all. My question for you, Mr. Kenney, is would you consider program policies or programs that enable students from around the world, from less wealthy countries like our own, and give them the opportunity to benefit from high-quality Canadian education and some work experience with the objective of returning to their homeland for the benefit of their country?